Welcome everyone. You are at workshop session 5B, which is the Adoption Files Initiative. Before we begin, I'll introduce myself. I'm Anna Gunlock. I am the administrative coordinator for the Central New York Southern Tier office at the Adoptive and Foster Family Coalition. I'm also an adoptive and foster parent currently. I will just go through the same things you've probably heard at all of the sessions, but there's training certificates available. Make sure your name in Zoom matches what you would want on your certificate. I will put links in the chat box. If you have any questions, please feel free to put those in the chat as well. We have a virtual book table. 15% is donated to the coalition. And please fill out the survey and I will put the link and everything there now. So with all of that said, we will get started. So the two presenters today are Rena Konomis, I hope I got that right, and Angela Tucker. Rena has moved from a successful career in technology for 20 years to being a leader in the field of adoption. Currently, she works as the Washington State Court appointed Confidential Intermediary, providing services to those within the adoption triad. She's held board positions for public companies, Canadian Manufacturers and Exporters Association, FedEx, Customer Outreach, and Advanced Technology Council, and she's currently the president of the board of directors for Harambee Cultural Society. Her project management experience led her team to an international accreditation for child welfare services. Rena's hope is to influence change for those who aspire to find their truth. And we also have Angela Tucker, who is the director of Amara's post-adoption program and the founder of the Adopted Life. She is also an adoptee who grew up in a closed adoption. At the age of 26, her search for her birth parents was featured in the groundbreaking documentary Closure. She spearheaded this initiative after receiving a phone call in 2017 from an adoptee who called the agency and said, "I call Amara every decade to see if my biological parents have ever reached out to you." Angela told the woman she'd check her file and get back to her. In her file, she found a signed waiver from the biological mother, which was signed in 2004, giving Amara permission to disclose her identity to the biological child. When Angela tried to reach out to the biological mother, she learned that she'd passed away in 2006. Angela then had to call the adoptee to tell her that her birth mother did want to have contact, but that they failed to connect them. And so it was that call that led to the inception of the Adoption Files Initiative.
Great, thank you.
Well, welcome everybody. We're really excited to be together for the first time in over a year in the same space and share the initiative that we've been working on. We truly believe it's an unprecedented initiative that we are doing to make amends for all of the historical adoption practices that Amara and most agencies incur over time. So you've heard who we are, a little bit of some changes. I'm now running the program, post-adopt program at Amara, and Angela's moving into becoming an international author, among many other activities.
Yes. Yeah. And so to kind of speed us up, I just want to go through a few of the decades, like primary adoption related practices that have gotten us to where we are today. So I'm going to just do really high level because I think a lot of us may be familiar with this, but just it'll give context to how why we are where we are today. So if we think back to the 50s, and the Florence Crittenden homes were where women would be sent away to give birth to their children, and then the children would be adopted without a lot of, with primary goal was secrecy, right? So there wasn't any conversation between adoptive parents and birth parents. It was all secretive. And then in the 60s, the primary goal was to match. So in the 60s, adoption agencies would go as far as checking adoptive parents, like their bone density kind of thing. They'd be like, are they big boned? We're going to place them with a child who's also big boned. And it was more than just eye color, hair color, skin color, of course, but really, again, that goal was secrecy. We don't want anyone to know that this adoption took place. We want people to think that they are biologically related, essentially. And then in the 70s, which was the baby scoop era, confidential intermediary laws came into play. And this is where people were starting to say, I want to connect, I want to meet people. And so confidential intermediaries were people who all over the United States were appointed by the state to be certified to go in and look at the files and connect people if they were able to do that. 1980s and even prior to that, but in 1980s, people really kind of started thinking about the issues with falsifying birth certificates, and thus leading into adoptees not knowing who their birth parents were. We know now where there's, I think Iowa recently, just yesterday passed a new law that allows adoptees to get their original birth certificates, which is really great. Ultimately, that's the document that likely, Iowa, thanks Annette, Iowa with redactions. Allowing adoptees to have an original birth certificate often will allow us to see our birth mother's name, and if she puts anyone else on that document, then we might be able to know our birth father's name too. In 1990, so this is more specific to our agency, Amara, but in 1990, when as we're auditing these files, we're seeing a lot of kind of a list of menu options. So if someone reached out to us saying, I want to know my biological mother, we might respond with a letter that would say, to have us go through your file cost this much, to have us make copies of papers cost this much, to have us do an actual search costs this much. And just what we believe now, charging people for things that are inherently theirs and their right to own in the first place. And we really see that these charges and just sending that letter was a deterrent, because people wouldn't know ultimately how much they might need to pay because they didn't know what was in their file. So all of these things together lead us to where we are now, towards hopefully making amends with these practices, which many people thought were in the best interest of the child at the time. So kind of the summation: problem, laws that prohibit adoptees from getting access to our files. Problem is the secrecy, the systemic practices that wouldn't allow people to know their own truths. And then the final piece is the agency, and agencies prioritizing adoptive parents and their desire to adopt children, prioritizing that above thinking about the lifelong needs for adoptees.
So I do want to mention that if you guys have any questions as we're going through our presentation, please feel free to use the chat, and Angela or I will be able to kind of monitor some of the questions and make sure that we're focusing on areas that people have interest in. So feel free to use the chat. So what we really want to do today and what we want to accomplish is to explain the initiative and the awareness that we want to bring out to everyone, and that it is something that's worthwhile doing and showing how we're successfully going through thousands of files. We're going to talk about how it brings awareness to people's complete story, information that had been previously prohibited from sharing with people. Definitely talking about how our agencies can take the responsibility and be a role model for other agencies and provide a proven process. And they're really, right now, there's the model that we use is not a real financial burden to Amara at all. So we'll talk about how we've successfully incorporated amazing volunteers through this initiative. Can you switch it? Thanks. So we really want to take a look at, what are the values that we want to focus on to make change in a very positive, strategic way. So we definitely want to ensure that the adoptee is the focus for most of what the work we are doing. We also want to be supportive to birth family members. We have a lot of information about birth siblings, and a lot of the searches that I do is sibling related, especially during the last year of COVID. We want to make sure that we're following very stringent ethical guidelines, and we want to create new norms. We want to really have an effect on best practices. Ultimately, what we're looking at is we're taking steps to make reparations for practices that were harmful. And so in the reparations that we're doing today, we do really want to balance the strong desire to make things right, but at the same time, not do any additional harm. So we'll talk about that balance that we do and how we believe we're able to move forward with that. So we look at who are the moderators for this initiative, and we kind of decided there's two very specific lenses that we use. So we have the individuals. We look at the adoptees, birth parents, adoptive families, and we consider, what life stage are they in? Have they had a successful reunification? What does successful even mean? And do they have a support network? Are we going to be able to provide them with a support network if they don't have anyone? And then from a system standpoint, how do we design this to be able to replicate for other agencies to show that this is just such a worthwhile initiative to take on? So in the work that we do, we pay special attention in two different lenses. So our focus, okay, switch. Our focus for each of those moderators is for the individuals. We physically review every single adoption file. So we read the margins of handwritten notes. We read through the old typed onion paper documents. We read through all of the legal documents, and then we contact them to make amends. We're very cautious when we find someone within the file. Everyone has made some kind of a contact to us right now that we do decide to connect to. And we offer to make amends. We let them know we were aware of their requests. We fell down and didn't fulfill what should have been provided to them. And we let them know what's available today. What are the laws today? What are the best practices today? And then we let them decide when they would like the information. And if they ever want the information, it'll be available. We have a commitment from Amara that right now we know that in 99 years, you're allowed to destroy the files. And the leadership at Amara has no plans because we are a 100-year-old agency. And I have seen files as old as 1916, and they're keeping them in archived rooms. So we're very fortunate in that sense. So from the system standpoint, we want a standardized process. We want to be able to review files in a very intentional way that is fair and understood by our auditors. We talked about ethical guidelines, and I'll talk about the amazing ethical advisory committee that we have in place. And we want to bring awareness to the public. So we're reaching out to people. We're attending conferences. We're talking to people as much as we can to really encourage people to join the journey that we're on. So the way we measure our successes is, are we providing people with awareness of their information? There's a lot of times that I talk to people, birth parents, adoptees, and they're not even aware of what information they have the right to. So just raising that awareness for people to know, when you're ready, when you want to do it, you should be allowed to ask. So that actually gives them more control. They can decide how they get it, when they get it, who they share it with. And I think that goes, I mean, that's just something that's never been allowed to give to them, is that kind of control. And, you know, hopefully we'll fully audit all of the files over time. And then we're making our systems, you know, we're talking to constituencies to show how we're doing it, offering ideas and support. And then we really do want to increase the number of agencies that are doing this. And right now we've got 2 that are in the initial stages of talking to us. So we're really excited and hope maybe after today, there'll be more people that would like to talk to us about it. So our expectations are to decrease ambiguous loss for adoptees, especially, and birth parents. And we want to increase the family connections, whether it gives a more fuller story to an adoptee for their adoptive family, for birth families and adoptees themselves. It gives them an ability to make decisions on how they want to continue with those family connections. I'll talk about it a little bit more in a few slides, but it's, we're not just going in and saying, hey, do you want us to search for someone? It's giving people the access to information that is just the most important first step, and then letting them decide what they want to do with that information. We're absolutely influencing best practices. We can see it in Amara already, how we're changing, how we're writing case notes, how we're collecting information. The people on our advisory committee are also going back to their agencies and looking at their best practices, so we can feel that this initiative is having a concrete influence. Ultimately, my goal is to change some of the access laws in Washington state. And I know New York has changed their access laws in the last couple of years, year and a half. And I'm looking forward to starting that work directly with the state very soon. So at a really high level, how do we do this? Well, we recruit amazing volunteers. They are trained in auditing, they're trained in data collection. They read through every single file, and then they collect specific information that we're trying to track. Some of the information is for reporting for ourselves and as we get together with other agencies, but the other information is when we do decide to go search for someone, we'll have basic information available to them. Our recruiters, our volunteers are trained on how to determine a file requires a follow-up, and then those follow-up files are reviewed at an ethics committee. And then the ethics committee, based on very stringent ethical guidelines that we're trying to apply, decide if we go ahead and contact anyone in that file and whose rights are foremost in that file as well. And we make amends. We talk to people on a very regular basis. People were successful at searching, and they call and they, I've never had someone really mad that it took so many years, and I'm talking decades in some cases. And they're just really happy that they're happy. I mean, they're still interested in the information they requested, even if it was decades ago. And then today is a good example of our awareness and hope for future partnerships. So at Amara, we have about 3,400 adoption files that we're going through as the first phase of this initiative. We've chosen between 1950 to 2000. We are able to successfully so far contact people from the 50s who were adopted, and they're still alive. And they're still wanting, even if it is just a non-identifying information letter, giving them some of their basic information that they have available. they're still wanting that information. There's also an opportunity for sibling connections that some people are interested in as well. And we're stopping right now at 2000 because we feel that there is an assumption that open adoption became more of a best practice in the 2000s, as social media and ancestry.com, Facebook, all of that has given people a little bit more power to search. So we haven't gone into the 2000s, and 3,400 files is a good start for us.
And Rena, you had a question about how many requests we have.
So we have on a monthly basis. So this people calling the agency asking for information from their adoption files. We're running at just over 20 a month right now. And it dramatically increased as COVID started. So once everybody, I think, I spoke with one gentleman and he was cleaning out old archive boxes from his parents and found that his mother had relinquished a son and he never knew about it. And it was through her old files. And he said, if it wasn't for COVID, I wouldn't have had the time to sit in my house and go through all these files. And then I've spoken with adoptees who have thought about looking through their files, have thought about reaching out to Amara, but life was too busy. And then all of a sudden life turned off and it gave them the opportunity. And there was nothing to cloud that thought anymore. There was no soccer practices or whatever was going on. There was no work. So it has increased substantially over the last year. So we look at, how did agencies cause harm? And we know specifically from Amara, but we also know from talking to so many other adoptees and adoptive parents and birth parents that this is fairly, similar to other agencies. But we did not fulfill correspondence obligations. Adoptive parents, birth parents, even adoptees would send items into us. They would send letters, photos, with the expectation that the agency was going to deliver them on their behalf. And there was just best practices, staffing, budgets that didn't have that go through. Sometimes it would be a caseworker just felt it was a better idea not to send it based on not really any concrete reasons. But the items would just sit in the files forever until we open them up for an audit. There's definitely a lot of assumptions made, judgments made by the agency on providing information. So where we have seen on many occasions non-identifying information letters, but a lot of the actual information that is available to them was decided it would not be wise to share with them. So they only got a very small snippet of what was available and were able to provide a lot more detail. And Angela talked about the financial burden. I mean, some of our searches would require, over $1,000, and there was no offering of financial aid or something in between. There was no sliding scale of financial payment or anything like that. So we see often, and I do talk to people when I find them, and they said, like, we just couldn't afford it. And I don't know I can afford it now either. And right now our agency is offering anything that's connected with this initiative to have no fees if the person cannot pay. So we found we had an adoptee who drew beautiful art for her birth mother, wonderful poems, and it was through her teenage years. And all of this artwork and poetry sat in the file and was never delivered. So she spent most of her 20s and 30s thinking that these items went through to her birth mother, and her birth mother just never bothered reaching back out to her. And so we searched for her to let her know all your items are still here. what would you like us to do with them? Do you want us to search for your birth mother and deliver them as we should have? Or do you want them back? And she hasn't decided yet. So we're holding on to them for her, but she knows at any point in time we can take action once she decides. For omissions and judgments, there was an adoptee who in 1952, she was adopted from foster care, and she had significant burn marks on her arm, and she's 70 now, and no one told her where these burn marks were. And she said her adoptive parents were never told. They adopted her as a toddler, and they were never told why she had these unbelievable burn marks on her arm. And she said, I just want to have an idea. I look at this every single day. And she called and got a non-ID letter in 1982 or 1986. And the caseworker decided it was too painful to tell her the information, and so didn't give her the details. And so we contacted her and asked her, we have your medical forms that we have to redact by law, but it will give you a little bit more of the information you're seeking. And she immediately asked for them to be faxed over or scanned over to her. So some people question, all these decades have gone by. Does it really still matter? And over and over and over again, we are getting evidence that it absolutely does matter. So we talked about the adoption laws and the access to original birth certificates. I am always in a position where I have to explain to an adoptee what their original birth certificate is. Most of the time, they're not even aware that they had an original one. They just see the one with their adoptive parents on it and assume that's the only one in existence. And we know that this document is important for many reasons. It does give you your full first and last name of your birth mother and the exact detail of where you were born, and possibly information about your birth father. But it's also a document that really helps if you ever decide to search, because it's the first piece of information that kind of kicks off that search. So there's, I guess, 10 states that have unrestricted access for adoptees to original birth certificates, and I believe New York is one of them. Compromised, so it was Iowa, is now probably in the compromised. So there's limited rights for an adoptee to access their original birth certificates. Washington is one of the compromised sites. And I'm building up information to start to write a law. And I'll be using a lot of the wording from New York to apply to Washington as well.
And you got a question about that from Gregory, who talked about how birth parents can veto disclosure.
Yes.
And was wondering if that was something we were addressing, wanted to address with legislation too.
It will be, I've been told by, and I don't have the woman's name, but one of the people that worked on the New York state law talked about the law needs to be very succinct in a very focused way. And so they were suggesting just going for adoptees' access to the birth certificate and not including the different rights of a birth parent. So I'm really new on the learning curve on this. I know for Washington, a birth mother can put a do not release on the certificate. But when they did make that law in 2012, they didn't really advertise it. So there is almost none with that deny statement on it. So I'm not sure how we're going to address that for sure. Part of Amara's work is we have birth parent allies, and I will be asking and seeking their input on that. And unfortunately, there's still 20 states that have virtually no access to original birth certificates at all. So how do we do this? Well, we have a part-time staff member that runs the initiative. We have anywhere between 10 and 25 volunteers that come in on a regular basis to our office. The volunteers were banging at our door as Washington moved through the phases of COVID and the roadmap to returning to work. And I have 12 active volunteers in the office right now. It's fully integrated into the post-adoption program. It's an absolute part of what we offer to adoptees and the people who love them. We have a volunteer ethical advisory team. They are across, I think, 8 different states, and we have a person from New Zealand who has also joined us recently. And the budget is really quite minimal. It's running very, very tight, but it is very successful. Switch it
There
over.
was just a note that the New York Adoptee Rights Coalition are basically all on this Zoom.
Oh,
So
right.
I said,
Yes,
we're following in your footsteps.
Absolutely, yes. So we talk, our volunteers are such a diverse group of people who come in for different reasons. Student interns have been great as well because they're very detail oriented and are aware of all of the different, software packages that we use. And one of our Duke student interns that we had for an entire summer, she had no relation to adoption. She wasn't quite sure where she was going to go when she graduated. And she just had a lovely remark about, looking at old baby pictures, reading through interviews with adoptive and birth parents, and scanning over the minute details of every unique adoption. It's hard not to feel an intimate connection to the people whose information is contained in these unconspicuous manila folders. I mean, the volunteers are absolutely affected. You can tell they talk about when they open up that folder, they realize they are they are putting themselves into a story that is going to have an effect on them as well. So we're very fortunate with the people that we have come to us. A lot of them are from the different professional backgrounds, social work, medical, legal, technology. They're retired and current. They're really looking at a way to take their professional knowledge and apply it in a volunteer role. And many of them talk to me about, a lot of the volunteer roles are, crafty or really administratively, or, I don't want to be with kids. That's not what I'm looking for. I'm trying to do something that feels like what I'm doing in my job, or I've retired and I have all this time and I feel my professional experience can help. And so we've had really wonderful success. We have workstations set up for them. They have a schedule. They come in. They're very committed. The training is there. The support is there. And it's been wonderful.
Yeah, and I just want to add, because Michael asked a question right on time, how have the volunteers described their experience with this work? He just asked as we went to the slide, but I just want to add that it's, as an adoptee, as I'm sitting in my office looking out at these volunteers who are reading these files, I love the sense of kind of reverence that they show towards the files. Like, it does feel like the volunteers understand the magnitude of what it is to hold a file that the person whose story it's about can't even access it. And they show that by the care that they give to each file, making sure that it gets back into the locked box that it's supposed to. And it definitely feels like they immerse themselves in that story in a way that I'm proud and would be proud to let that adoptee know that this person has been handling your story.
And it's I'm not quite, yeah, I was just gonna say it's a the volunteers are taking this into their day-to-day work. We have several lawyers that are considering what they're doing and possibly changing their life's work. We have students that weren't totally committed to a specific path, but this is helping them decide. And, there's people who we have adoptees that do the reviews. One adoptee had made the decision to talk to her adoptive parent, her adoptive mother, to say, you know, I want to know this information. And her mother had a folder of details that she didn't think her daughter wanted. And they, you know, so there's conversations that are happening with these people as they leave Amara, and we're able to, you know, kind of continue to propagate the awareness through the community. We also offer a semi-regular follow-up with all the volunteers, because it is emotional work, and it does, you know, put a burden on their hearts, because a lot of them just weren't aware of any of this information. So we give them space to, you know, we're very flexible on the schedules. Certainly if there's a file that they're uncomfortable with, they can return it. And we just give them an opportunity to talk with each other. And as we're moving more and more back into the workplace, they can start talking again to each other. And they've told me that's one of the things that they miss the most, is, you know, they could just kind of look up and talk to another volunteer about, gosh, have you ever read this before? And how, you know, just the thoughts and feelings around that. I'm very proud of our volunteers. Yeah. Oh, I'm gonna go next. So we're seeing that about 22% of the files that we review require amends, and that's an action that we have to take. And that could be because they were offered a fee letter and no action was taken. It could be that we have found certain items in the files, and it's just, or it's that we have to, you know, contact the person because they've asked for search supports and never received them. We talked about waivers. Waivers of confidentiality is what Amara refers to them as, where a party of the file can say, you know, if anyone contacts you, I'm open to being contacted and share my information. And the way the process is, once you have two matching waivers, you can then go ahead and contact the person. Well, one of the things that this initiative has shown us is that we have a lot of matching waivers that nobody took action to. And I think it's because of the training of past staff. They received a waiver in the mail, they just popped it into the file, not realizing they should have looked for a matching one. And we are actively going back to people saying, hey, you know, in 1992, you filled out a waiver, and, you know, 10 years later, we have another waiver. Are you still interested? And in every case that we've done that for, both parties have said yes, absolutely.
So this 22% is out of the 3,300 files.
The 22% is of what files we've done, and we're about 25% done. But the 22% is holding pretty steady as we go forward through. Yeah. So the reasons that we make amends, and these are the reasons that, you know, these are the 5 points that each auditor is looking for, is there unfulfilled correspondences? Is there photos or letters that were meant to be sent along and Amara didn't do it? Are there search requests that we didn't fulfill? Items, we are finding photos for sure, cards, we are finding jewelry, and the 2 pieces of jewelry that we found, we've successfully been able to get them to the person that they were meant for. There's a lot of inaction to waivers that we're following up on. And in the older folders in the 50s and 60s, there's definitely omissions that were made because of the way judgments were used in caseworking at the time. So that looks funky. This doesn't add up to 100% because in most cases, there's multiple reasons within a file that that we have to follow up on. So most of them are non-identifying information requests. Many of them are for searches. And so we're going back out and offering the information to people should they wish to have them at the same time. Let's see here. And I will say, we started this initiative under the name of Project Search and Reunion. And we when I would find an adoptee or a birth parent, they would be very defensive. They would be like, I'm not looking to search. I was never wanting to search. I just wanted some information. And I would explain to them, no, I'm not telling you you have to search, but you asked for non-identifying information. You asked for some medical information, and I can get that for you. And I started to realize that um, the words within the non-ID are what was important, the content of the information, the snippets of their birth mother's life at the time of their birth was what was really important. So we actually changed the name because we were realizing people were not contacting us because they thought our primary focus was to search. We talked to an adoptee who was adopted in 1956. And in the birth mother conversations with the caseworker at the time, she talked about how she was a horsewoman. She loved horses. She worked at a barn. She was completely, that's what she wanted to do. She wanted to become a veterinarian. And when we found the adoptee, who is in her late 60s now, I told, it was in her non-ID that her mother was this horse person. And she started laughing and she said, I so wish my mom and dad were still alive because I grew up on a farm, but they never had horses. And all I ever wanted was a horse. And they finally let me have one when I was 14. And I would have loved to have been able to tell them, now I know why I wanted a horse so bad. And just to be able to make that kind of information, you realize it's the words that are important, not always the action of going to look. And she was just really thrilled to get that snippet of information about her birth mother. So the way we make amends is once a decision is made that we do have something to make reparations for, we search for the person that we've determined is the one whose rights are foremost in the follow-up. We discreetly contact them. We follow all of the ethical requirements of a confidential intermediary. We don't assume that they've shared their story. We allow in the wording of the letter to not make a proclamation that they are the exact person we're looking for. We explain to them why we're contacting them so they can see that there's concrete information that we know, that we have their file. We allow them as much grace as they require. There's no end date to this at all. And we tell them it is our initiative. It is something that we're offering to them should they ever decide. And we use the ethical committee. There was no guidelines that we could find around this. So we looked at medical kind of confidentiality on files. We talked to a lot of lawyers, and we're following Reamer's 7 steps. So we go through the process. We ensure that we're making all of our decisions soundly. We prioritize ethics in the review that we're doing, and we're using the same list of questions for every file that we follow up. So there's consistency in the way that we manage our ethical reviews.
And some of you may know Ann Babb, who I talked with her really early on when I started this work about ethics. And so she also kind of gave me some guidance around how initially for me to create the ethics team, and then what types of questions do we need to ask for every file to make sure that we were consistent.
Yeah. So we have an amazingly committed ethical advisory committee. So we have adoptees, adoptive parents, we have birth parents, adoptive grandparents. Every one of our advisors have adoption competencies in the work that they do, whether they are lawyers, social workers, confidential intermediaries. We have genealogists online who has expertise in the ancestry and 23andMe work that she does. We have a Fulbright scholar, and her entire work is devoted to adoption, kinship adoption, as well as transracial adoption. And we meet on a pretty close to monthly monthly time schedule. And it's very rare that people are not on the call. It's a very intense review. It's about an hour and a half. And I have to say, at the beginning of the ethics committee, everybody was very polite and kind to each other. And now there's a lot of critical discussions, and the weight of deciding whose rights outweigh the other is a really difficult conversation. Is it the birth mother? Is it the adoptee? How do you decide which one you take action to? We know in the early decades, social workers would promise birth mothers that nobody will ever find out. And that's just not a promise that we can keep. But then we have to be sensitive around what are the expectations for that birth mother. So we look at a very defined list, and I think I'll switch to the next slide here.
Okay, and I also just want to put a plug out that, of course, we're always open to additional members of the ethics committee. So I know there's lots of people in this room today that might have an interest, and please reach out to us. We are strict, of course, because it's a highly sensitive role. But if folks have a background that could be helpful as we work through these quandaries, we would love to hear from you.
I also have commitment from everybody on the ethics committee that as agencies take on this work, they are willing to propagate into those other ethics advisory committees so that you're not starting from square one, that they would become part of your ethics committee as well, if you would like to invite them there, whether as a permanent position with you in that ethics committee, or just as someone to train and introduce the way we go through the process.
Yeah.
But they're all very committed to it. So we asked the question, if we talk about a search request, given that an adoptee in 1976 requested a search, is it ethically justifiable to contact them today to ask if they would still like us to take on that work for them? And then we review the attributes of that file. Did the birth parent state anywhere during the conversations with our caseworkers that absolutely do not contact me? Is there any other aspects that we have to consider when we're setting the rights and the priority of whose rights are affected? Did we make promises that we just can no longer keep? The most obvious one that we see over and over again in the 50s is they were really promised that nobody would ever contact them. We have birth parents on our advisory committee, and they've said, we don't want people to find us to just say thank you. That's not at all what we're interested in. So we have to consider, why are we going to contact someone? And the utmost concern is, are we going to create more harm by contacting them? And so those are the discussions we have with all the files. We're definitely coming up with some standardized review processes. If someone asks for a non-ID and they never received it, we don't go through the ethics committee anymore, because we have enough evidence from all of the reviews that say we should at least contact them and offer it to them if they would like it. So we are starting to get some fairly specific procedures.
Annette, I see your notes, and I think we're nearing the end of our presentation,
Okay,
and we
good.
might have a minute for you to speak it out loud, because I'm not sure I quite understand. So
okay, we're almost done actually. So this is just an example of one of the, we actually found a ring that Patty put on a necklace. So her birth mother dropped off the ring in 1952, I think, and said, can you please give this ring to the adoptive parents and ask that they give it to my birth daughter when she turns 16. The caseworker put it into a little brown envelope, wrote her name on it, and then in her case note said, there's no way I would put the burden of this on the adoptive parents. and the ring sat there until 2016. And Angela found it in 2016 and didn't know what to do with it. And then we created a more formal ethical review. We brought it to the ethics committee and decided we're going to try and find this adoptee and get it out to her. And she's been absolutely thrilled with it. I mean, this is a bit of a Hallmark story, so to speak. But she said, it's been a gentle elation that colors the rest of my life brighter. She has grandchildren. She has several kids that she's raised, and it's just something that is with her now that she can share with her family, and it is a real something from her birth mother. Her birth mother left it for her, and we finally were able to provide it to her. I've had contact with other adoptees. An adoptee had contacted us multiple times asking for non-ID letters, his non-ID letter, and he kept getting our fee letter back saying, yeah, that sounds like a great idea. Here's how much you have to pay. And he would, 10 years later, he would ask again and he would get the same letter back. So I was successful in finding him. And he was like, yeah, I do want my non-identifying information in my medical letter. And when I called him to say I had it ready, he said, I'm ashamed to admit that I am somehow fearful of what you may be providing me. I've lived all this time with puzzle pieces in my life, and I know you can't unknow something once it's revealed. But at the same time, I've wanted it so long. And we talked about like how he was like, I'm ashamed to want this and and I think the shame came from asking so many times and not being able to just be told, yes, it is yours. We owe you this. You should be able to ask for this information. And he's actually someone I've been in contact with a few times, and it's progressed through. But, the words within those files, it's the adoptees' right to get some access to that information. So I guess we have a few minutes that I can't quite see all the questions in the chat, but I've seen it's been busy.
Yeah, I'm thinking, Annette, I don't know if you might want to just take yourself off mute.
Hi.
Yeah. Hi. Yeah.
The ones where I was sending it to you, Angela, I actually meant to put it to everyone.
Oh,
Going blind,
okay.
can't always see. In New York, what we found was that the quote unquote promises of confidentiality, they were made by social workers. And really the promise was, oh, it's okay, Sally, no one's going to find out that you're in the maternity home. Right. There were no promises made by legislators or legislatures at all. And nobody can promise anyone a lifetime of anonymity, certainly not in today's day and age. Of note for your work, potential work in Washington, what we found really helped with educating the legislators here in New York was going in and saying things like, if the current legislation read New York City firemen can't apply for and obtain their original birth certificate, Jewish people, African Americans, going through a list of marginalized people and not marginalized people, would you approve of this legislation? And they were kind of like, huh? Mm-hmm. And then the answer was, well, because everyone that we just listed here is represented in the adoption community. An adoptee represents every single one of those. So that ended up being something that worked really well. Claudia was with me when we were doing the lobbying. Greg Luce had flown in from Minnesota to do lobbying with us also. So really bringing things down to the bottom line for them by today's standards really helped so much in educating them. And the education of people is really what's key for everything, right? It all factors down to the education, but this anonymity and confidentiality, like there just wasn't any. And as for the questions of, who did the agency represent? Yes. We're never the choice. The adopted person is never, the commodity is never the choice of who was represented or who is represented now, right? They still shut the doors on us.
Right.
Yeah, we have a
They
lot.
only use birth
Often,
parents now to keep the door shut. I can tell you that we are not the clients in the get-go from the beginning. And at this point in time, it is frustrating as all living heck. And I just testified to Massachusetts for this. And I said, you know, when I was 19 and vulnerable and alone, you guys let me make this decision by myself and said, oh, okay, you're wonderful. But when I was, you know, 30 something and saying, please let me know where my son is, you know, then you have to protect me. No, it doesn't work that way. You know, it's very unfair.
Right.
we
I also
often
put in chat
grapple. Sorry.
It's okay, sorry. I was just gonna say, I just put in chat too a link to Elizabeth Samuel's report on privacy, this issue, and the actual surrender documents. There has never been a surrender document that actually has promises of confidentiality on it. Everything was verbal, and the law code always opened up records by the court if they wanted to. They don't, but they did.
And tonight's Friday night presentation also speaks to the history and the secrecy of adoption and how the infants were actually treated. Like I know for myself, because I know women who were in the same maternity home at the same exact time that my birth mother was there. We were actually housed in a separate section of the nursery. We couldn't even be in the nursery with the children who were born of wedlock. We were those babies, and the people who would come by the nursery to see their children knew that we were those babies and referred to us as those babies. So that comes into play with the shame as well, the being told like, you don't need your records, you were, you know, you're better off, you should be grateful. The whole narrative that people from my generation were fed and the indoctrination that we were fed leads into our feelings of shame as to why, you know, why we want to know who we were or what was given to us or anything at all. Just adding my 2 cents in, thanks.
Yeah, we love your 2 cents. We want more cents from you. There was another question that, Rena, we continually battle against, which was around who is the client?
Oh, yes. Yeah, we grapple with who owns the file over and over again. And, you know, you can talk to 5 lawyers and they'll give you 5 different answers. Same with social workers, physicians. So we don't have an answer, but it is something that, we know who deserves to own it, but who actually owns it is not set.
Are there any other questions before we, I mean, I want to reinforce how eager we are to take this on in other agencies. Like primary hope is that we've built this so that it's low cost and we can provide all of the materials that we use so people can kind of pick up and go. So if you work for an agency, if you're connected with one, they likely have all their files unless it went away in a fire or a flood, like we talked about in the chat. And that we would love to see this initiative just take off in other places. So yes, please reach out. But any other questions?
Can I just ask one thing? So these agencies, which are predominantly Catholic agencies across the world who say the fires, the floods, everything shy of the plagues of locusts, is there any way to actually find out whether or not they actually housed our records in said places that did actually burn? Like where my agency told me my records were stored, I know that that place burned, right? Oh. And I've requested proof that they housed anyone's records there. And they just continue to like deny my requests and ignore my requests. So is there any way? So it's great. Like I could find out, right, that there was a house fire and say, oh, I had all my money in a mattress in that house across the street that burned down. But who's to prove it? Like, is there any way to get these agencies to be actually honest and like find actual proof, like, or no?
I don't think so, but that reminds me of our next step is doing some digital work with all the files. Like, of course we want to keep originals, but we also would love money to make sure these are all electronic now.
Yeah.
But no, I don't know that there's a way
short of just
infiltrating the
walking
right
in.
So we just have to take what they're saying at face value.
Unfortunately.
Because in my case, they said, oh, well, your records were destroyed in a fire, but we do have an index card that indicated that your mother was 18 and she signed the papers when you were 5 months old and blah, blah. And I was like, really? Was it made of Kevlar in 1967? The index card survived the fire?
Yeah.
Like, come on now.
Yeah.
Yeah, we have those index cards as well. Yeah.
That's crazy.
My guess is the index cards were probably on their main site and was an easy reference. So that could be why they have it. Yeah.
Mm.
It's an interesting thing for discussion, just as an FYI. The majority of birth parents have no files. Like 99% of the time, I know other birth parents talking like, I don't have this, I don't have that, I don't know what I signed, I don't have a copy of this,
True.
I don't have a copy of that.
Right.
And that is also, so that's just another thing to think about.
Yeah,
as
and that's
opposed
true
to-
at our agency too. There's
Yeah.
no birth parent file. It's just
Yeah, the files at Amara and I think in other agencies are the adoptive parents. So if they've adopted multiple children, they all go into the same file. So there's multiple birth parent names in the files as well. Yeah.
Thank you so much. I just wish that this initiative could also go into the state system, because not all parents who are TPR'd for horrendous amounts of abuse. Sometimes there's a mental health issue where TPR is the only avenue. They can't go with a voluntary surrender. I know in the case of our child, who is still a child, so I can call her that, I begged her guardian ad litem to include in the paperwork that I would have an obligation to send her biological parents a yearly update, because I knew if it wasn't in the paperwork, the state wouldn't accept it. And we have another child a non-genetic sibling who we have obligations for. And they didn't write it in. And my first year when I went to present one child's information, and I wanted to present the other child's information, they wouldn't take the second child's information. And because of mental health issues, it's also very hard to be able to track this person down or other family members. So I really wish that initiative could apply to some of the other, because they have a right to know that she's beautiful and healthy and amazing, even if they're not in a position to get to know her as a person. And I just say one thing with Peter, raising two children, one who has a connection to their family and one who doesn't, there's a certain relief of being able to say to the one child who asks a question, I say, and especially that's the child I didn't meet till they were 3, be able to go, I don't know, let's call your grandmother, she might have that answer, because I didn't meet you till you were 3. And being able to pick up the phone and him being able to say da 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 da. And it doesn't make me any less of a parent. It just means that they have less pieces I have to help them track down later.
I have a podcast called The Adoptee Next Door where I interview adoptees. I also have a web series called The Adopted Life, and I'm interviewing transracially adopted youth. And both of those, I'm trying to just give lots of voices for adoptees to share their perspectives, and maybe that would be a great place to start.
It's hard for a child to have an empty space because they're going to fill it. And they're going to fill it with what they think and decide their worth is. And that's not likely to be very positive.